The statistics are staggering, and the problem is overwhelming. As medical professionals, you understand how difficult it is to manage your patient's weight loss. LeanMD takes the burden off of the physicians and your staff with a turnkey program designed for long-term results.
It's been very hard, probably the last 15 to 20 years, as I've seen my patients gaining a lot of weight, and I find that I end up putting them on cholesterol medication, blood pressure medication, maybe one or two, and diabetes medications. And I encourage them to lose weight. I know if they would just lose 30, 40, 50 pounds, I could take them off all those medications.
The number one recommendation that almost anybody, the American Diabetes Association, Heart Association, the American Academy of Family Physicians, is try weight loss and lifestyle changes as step one before we should put you on a medication for the rest of your life.
So I started the LeanMD program in August, and I weighed 338 pounds. And it's been 7 months since then, and I weigh 255 pounds now.
As a primary care doc for about 10 years, you quickly realize that the center of the target of most people's health problems is their belly.
You know, you're always skeptical when you hear about the new diet and the new trend. But my doctor told me about this one, and I trust my doctor. So that's what made me decide to try LeanMD.
I think what LeanMD makes it a different program than the others is that it's medically supported, so that a physician is actually in charge of the program, that patients can actually not only just use real foods to lose weight, but they can also use medications if they need to, and not all programs offer that.
You can unravel all of these chronic conditions by weight loss and lifestyle changes.
Now, physicians can easily support patients with LeanMD. As an evidence-based, medically supported weight loss program, it is proven 4 times more effective than existing weight loss programs. LeanMD is a comprehensive subscription-based program to assist your staff, your patients, and your practice.
I've been attempting to do a medical weight loss practice for the last few years and trying to design it myself. It was a challenge. And once I saw the materials that LeanMD had, it was everything that I ever dreamed of creating myself and more.
When you're part of the LeanMD community of practices, you get to leverage years of clinical experience, highly refined documentation, and patient-facing materials that are highly mature and very sophisticated and well put together.
It's just wonderful to have a program where everything is done for you, and the physician's time is very minimal, and the administrative time is 0.
And from a financial perspective, it is a cash-based business, and it has really helped supplement revenue in my practice, which has really taken a lot of pressure and strain off of my practice.
It's also very nice to have a cash practice in this time of decreased reimbursements and increased overhead.
Not only do we gain a weight loss patient that's sustaining to our practice from a financial standpoint, we actually then get to take care of them and often their additional family members for their routine primary care. So it's a revenue generator for the practice. It's also a practice builder for our traditional side of our practice.
Imagine adding $250,000 a year to your practice by helping your patients lose weight.
It's truly turnkey from the time of being able to commit to wanting to launch a LeanMD program in your practice. It just takes a few weeks to go live. It's easy. It's not a significant distraction for your practice. Almost immediately within the first few handful of patients, you'll earn back whatever investment you had to make up front.
What's been extremely helpful is it's a program that is completely already organized and set up.
It's a consistently branded experience. It's a consistently integrated weight loss system.
With digital technology, a user-friendly app, virtual training, and remote monitoring, clinicians are supported in creating a personalized plan, and patients succeed at achieving their goals.
LeanMD was a collaboration of not only physicians, but of nutritionists and medical writers and attorneys and a lot of people that helped us put this program together and to make it run right. But first and foremost, we really tried to create it around something that was very simple to follow and real food.
In my opinion, LeanMD is one of the best, easiest, and most comprehensive weight loss programs in today's market.
Not only am I supported, but the mentors in my office are supported, and then the patients are supported.
As far as telephone calls, emails, contact with the patient, my mentor does everything.
The weekly visits with your mentor. You're seeing results, you're seeing progress, and you're getting encouraged.
And we have all kinds of training and focused sessions with them so that they can learn to help teach the patient how to navigate their food journey. And they are the critical partner to keep the patient on track.
It makes me happy as a doctor because I know it's a healthy way to do it.
Finally, a program that works for your patient, your staff, and your practice. LeanMD provides the tools, training, marketing, compliance, and billing to free up your time. Everyone will be pleased with the results.
It is so fun to see a patient that I've had for 25 years not be able to lose weight and come in grinning and ecstatic about not only their weight loss, but how easy it is to follow this program and how well they feel.
And when you're carrying so much weight, it hurts you. You don't think about it. But at the end of the day, when your back hurts and your knees hurt and your feet hurt, that's because you're carrying around all that weight. And I feel like a whole new person.
I don't believe any single practice could single-handedly design something on their own without spending years and tens of thousands of hours of time in developing that program as sophisticated as this.
Thank you for building such a simple, easy program that actually works. I can't stress that enough. I'm not an actor. I'm just a normal guy who had a lot of success in this program. I'm proof that it works. I love my new life. Thank you.
And that's what's really exciting about being a doctor is we actually get to really help people in a material way, not just pile on more blood pressure drugs and more cholesterol drugs. We get to help people solve the problem themselves, and that's been one of the greatest things. And in our practice, it makes us happy because we have all this good news going on as we're helping people transform their lives.
This is your opportunity to not only help change your patients' lives, it's your opportunity to practice medicine the way you want to while achieving financial freedom. Tested, proven, evidence-based, medically supported, and safe. LeanMD is the solution to help your patients on the road to better health. Please join us. Click below to schedule an appointment to learn how you can add up to $250,000 a year to your practice.